Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes with Valley Health. Tonsillitis is a really common condition, especially when we're talking about our kids. It can be uncomfortable, but it's typically manageable with proper treatment. So what exactly does that look like? We're talking with ear, nose, and throat doctor, Dr. Mark Sheridan, about that today. Thanks for being here.
No, you're welcome. Thank you.
Let's talk about tonsillitis. What are some of the common symptoms that kids, parents can watch for?
Well, the biggest thing is recurrent infections in the throat. So tonsillitis are the sort of lumps you see when you look back there. You see that little hangy down thing, as I love to call it, but that's called the uvula, and off to the sides. And when they're infected, they'll get little white dots or blisters on them, and can lead to, particularly if strep throat, it can lead to high infection and some other complications if you don't get it treated. And that's why it's so important to have it checked out to see, is it strep or is it just a different bacteria, which should be treated, but it's not as nefarious as the streptococcus.
Yeah, strep can be serious for
Big
your
time.
overall health, so you cannot mess around with that. Is there another primary cause, another cause of tonsillitis aside from strep?
Well, you can have viral strep or viral tonsillitis, not strep. There are other bacteria that cause tonsil infections. We just don't, I don't want to say we don't want to worry about them. They can be bad and lead to necessity to have the tonsils out. But the worst one is the strep.
How is tonsillitis diagnosed? Do you do a swab? Do you just visually look at it?
Well, and you can do a swab, and they'll do a rapid, oftentimes your primary care, they'll do a rapid swab and test. And that's probably about 80 to 90% accurate. Sometimes you'll go like, I swear it's strep, and it comes back negative, and it can still be. They'll send it off for a culture to see, just in case it didn't get enough on the test to positive on the little screening test they do. But if it's caused by a different bacteria, of course the strep test will be negative. But that can, as I said, can lead to other recurrent tonsillitis or pharyngitis infections. The other thing is looking in there. I've been doing this a long time. Most of the time, if you have strep and you come see me, I know it's strep throat just because you've seen it a million times. But not always, but yeah.
So say it's not strep, it is indeed tonsillitis. You mentioned surgery. When do you know it's a surgery option, or what other options are there?
So basically, for surgery, we look for the number of infections in a time frame, whether it's over a year or 2 years or 3 years. Sometimes it's just the size, and sometimes they just never get small, and you'll see your kids and sometimes adults, they'll be snoring and they'll be all over the bed and they don't rest well. And part of that is because they're trying to get in a position that they can breathe in, and because the tonsils can be that big. You may look in, they don't look big, but when we fall asleep, what happens? We all relax, so everything collapses in, and so then they have to fight that to get the air in, and they'll have that. Mild snoring is not a big deal, so don't, oh my God, Junior's snoring. No, you don't have to worry about that. But if they're really gasping and rolling in bed, then that's the concern you should talk to your primary care about.
And then that's where you're looking at.
And that's where you're looking at potentially getting the tonsils out. And it's not just tonsillectomy. People think, oh, it's just getting the tonsils out. It takes 2 weeks to heal. This is, I tell all the adult patients, it really takes 2 weeks. I've had women tell me this is worse than childbirth. And the biggest thing we worry about is the scab forms up there, and if they don't stay hydrated, the scab can come off and it'll bleed, and it's not like a cut on your arm. It's a much bigger deal if that happends sometimes.
Yeah, you really have to take it easy for those.
You really do.
So if surgery is not an option, are there home remedies that can help address tonsillitis?
If it is viral gargling, good oral hygiene, brush your teeth. I mean, take care of those kind of things. And it sounds silly, but it can be, because your mouth has a lot of bacteria.
What happens if you let tonsillitis go untreated? Are there potential complications?
So there are a couple of things. One of the things that we see, unfortunately, you can get an abscess around the tonsil, which involves having to have surgery to drain it. Sometimes it can get so bad it can go into the neck, and you have to have an incision on the outside to drain the abscess. Other things that we worry about, and that's why strep is such a big deal, is in pre-penicillin days and pre-antibiotic days, we worried about heart disease, caused valvular heart disease, and kidney problems. And occasionally we'll run into people that have had that because they've had such a virulent infection, even today, even with the antibiotics. But most of the time that's pretty rare. But grandma and grandpa, they knew friends, or maybe they even themselves have had that.
Right. So definitely sore throat, tonsillitis, get it checked out.
It's worth getting it checked out, absolutely.
All right, Dr. Sheridan, thank you so much. Some great information to pass along to people. We appreciate it.
Thank you.
Thanks for being here for Monday Health Minutes.